Doctor, thanks so much indeed. Listen, you're the expert, but I decided that probably let's start with the new breed of mosquito that has come to Africa from Asia. What about this particular development?
Right. Thank you for having me on the show. This isn't really not the time for us to receive new malaria vectors like Anopheles stephensi, as we've heard from Asia, and especially with the research that's going on to find out if this particular mosquito will be breeding in urban areas. And this will not only complicate the matters, but it will take back the gains we've made for a setback of over a decade. So it's highly concerning.
Okay, the research that I read, just if you could explain this to us a bit more. This strain, the stephensi strain that you're talking about, this particular mosquito breed that's come from Asia, that it can find its way through cracks in water tanks. Does that mean that it's looking for clean water? Because previously, is it correct that we know that mosquitoes breed in slightly dirtier water, but this breed is looking at clean water?
I think it's not only clean, but we were only seeing larvae of these mosquitoes in stagnant water. This particular strain of mosquito is seen to also thrive in moving water. And that means when the water is moving, it's not that contaminated. So the survival rate in the urban centers where we have pipe water and moving water would also make it a dangerous place for this kind of strain to flourish.
What about the strain of parasite then that has been found to be drug resistant? They did a study in Rwanda and they found that 7% of patients had this particular strain that's resistant to the drug is called artemisinin. Is that correct?
Yes, that's the one. That's the gold standard treatment for malaria.
So how is this going to affect the transmission of malaria, the mortality rate of malaria? Because, of course, for decades, experts like yourself have been saying that don't over-prescribe antibiotics because eventually we're going to get to this stage where a disease is not going to react to the drug that we're giving the patient.
Look, I think this is an absolute flag and a warning. Any injudicious use of medication leads to drug resistance. We've been talking about this. WHO has made it a flagship warning, not only in TB, but antibiotics for infections. And we had a situation with chloroquine a few years ago where there was misuse at drug sellers and pharmacies, and we had major resistance to chloroquine, which was a fantastic drug. This drug, artemisinin, is superb and it's been working well. We need to stop it at the early stages. And I'm really delighted that Rwanda is doing some studies, and we will have a huge advocacy campaign in Africa about judicious use of artemisinin because it's still a drug that's extremely effective. We do not want to see more drug resistance. This is a valuable drug.
A few years ago, I was speaking to a doctor who was doing some work for the US government on Ebola treatments. And he said to me, nobody has to die of Ebola. If you get the right treatment early enough, you will not die from Ebola. Is that the same as malaria? Should anybody be dying of malaria in the year 2020?
You're so right. And you know, the Global Fund actually echoes what you have asked, that nobody should be dying. If you look at early catching, prevention is better than cure. And I think the whole model of bed nets, as simple as it sounds, is a daunting task. And no one should die of malaria. Prevention is better than cure. But large numbers of people in Africa do ignore it and reach the hospital at later stages, mainly because of geographical and financial barriers. And that's the weakness in the health system that links to the high mortality rates that you've been projecting on the screen.
Okay, so how much help would Africa need from outside, and how much does it need to start becoming self-sufficient in its medical provisions, therefore?
Oh, wow. If you're asking about the amount of money, we're looking nothing less than $63 billion just talking about the impact and reducing this malaria burden that we're dealing with. So we need a huge amount just in terms of Africa. We need human resources, not only financial resources, and we need partnerships from global health institutions and partnerships from the government to effectively combat this infectious disease.
Amit, while you're with us, if you don't mind, I'd like to take advantage of your expertise and just ask you about the coronavirus. We just had a guest from Lagos. And in Nigeria, it's quite incredible, relatively, given the fact that 200 million people live in Nigeria, 57,000 cases or so, and just over 1,000 fatalities from the pandemic. Africa seems to be dealing with the coronavirus so much better than the richest countries in the world. How is that happening?
We had the advantage of watching and learning what failures developed countries went through. We had the advantage of preparing early. And we had the advantage of having had a previous pandemic. So let it be very clear that the government and the private sector, for the first time, converged to flatten the curve together. Lockdowns was not easy in Africa, but it was done much earlier than countries like Italy, UK, and US. Curfews were not easy. We did it. Food packages for the informal were done. So literally, Africa rose up to the challenge, having had the advantage of seeing the failures of the other countries. I think coupled with that, I think it's the age. Our median age in Africa is 18, 19, less than half of the many other countries that have been hit by high case fatality rates. And thirdly, we've been exposed to flu-like viruses before. I have no doubt that the level of immunity on flu-like illnesses in a continent like Africa may be a little higher than the other countries that are away from the equator.
Dr.
So all
Amit
those
Thakker,
factors have played in the favor.
Doctor, thank you so much indeed. Amit Thakker speaking to us from Nairobi.